Hi, I'm Brendan Higgins. Thanks for joining us for Plugged Into DFW. We begin with a topic that's on a lot of people's minds, healthcare and jobs. The demand for health information technology workers is on the rise. The Bureau of Labor Statistics projects a 20% increase in jobs by 2018. Dr. Gery Hochanadel of the Provost of Parker University here in North Texas is here with information on how you can find out more about this and perhaps get involved in this growing field. Welcome.
Good morning. It's good to be here.
What's the reason for the increase in this field?
Well, with the Affordable Health Care Act that has been implemented, it requires all of the providers within the healthcare to have a system of electronic health records. This has created a real demand for those individuals who have those degrees and skills to do that. As you mentioned, the Bureau of Labor said there's going to be a 22% increase over the next 10 years. Here in the state of Texas, they're projecting 10,000 new jobs in 2013 for health information managers. 57% of the practitioners and the healthcare institutions are saying they're having a very difficult time, that they're going to hire people for their team, and of that, 75% say they cannot find the qualified candidates to hire. So it's a great opportunity. It's a long-term, secure future in terms of a career, and given this economy, I think that's important as well.
What is somebody who graduates with a degree or certificate in this area? What could they look forward to in terms of what kind of title is it that you have when you do this job?
Well, they'll have a variety of titles, and probably all of them will have health information management behind it. The people who will work in that are the people who will manage the electronic records, health records of patients. And so really they have a multitude of responsibilities and duties. If you think of it as a software system, a data-driven software system, so there's going to be people that will need the information technology background, the computer science background. There will be people that will need to be the organization of data, the control, the security, how to provide it. And basically what they do is when a doctor inputs the information about a patient, the health information people are the ones that make sure that that information is accurate, that it is timely, that it is protected as required by federal law, and that it is available to the other healthcare providers who will access that information when they are treating that patient. I'll give you an example. You look at Parkland or Baylor hospital systems. When you go in, you may see your primary care physician. He inputs whatever he has done with you that day, whatever diagnosis, into an electronic health record system. Let's say he refers you to a specialist within that system. When you go to that specialist has access now to all of your data and doesn't have to start all over. But for some reason, we always get to fill out the new patient forms, but it is there. And it then allows the healthcare providers to provide the care and do it in a very timely manner and a very accurate manner.
What kind of individual are you looking for? I mean, who's cut out to go into a program like this?
Well, there's a variety of individuals. I mean, obviously those that have a technology interest in computer science, that like software, those that want to be involved with organization and management and direct those processes, those that want to be involved with education, because there are a number of degree programs that provide this kind of training and education. Those that want to be project managers in terms of implementing the software and the electronic health records and the different providers that don't have them now. So there's probably a multitude of opportunities, and just depending on the person's individual desire and their skill sets, they could go into a multitude of different positions.
And do you offer things ranging from what, associate degree to general 4-year degree?
Well, we are offering a new Bachelor of Science in Health Information Management, and it is a 4-year degree program. And there's a variety of courses in there, in that curriculum, that will allow a person to become knowledgeable about each of those areas I've just described. They need to understand medical technology, they need to understand diseases, they need to understand to be able to read and understand what the healthcare provider has put down about that particular patient. But they also need to know the legal requirements of how to protect information, They need to know the technology in terms of computer systems, softwares. So that degree will provide a person a well-rounded basis to move in whatever direction they want to within the health information management career.
Tell me about new programs that you're offering this coming up session for people who are just entering.
Sure. Well, first I want to talk about the new Bachelor of Science degree in Health Information Management. That will begin in January. This program is unique in that this will be our first fully online degree program. Students, no parking required, anytime, anywhere. What I like about this is designed for the adult learner. We will teach one class at a time. Each class will last 1 month. So students will be able to start every month over a 12-month period into the program. The other thing I like about it is that we've implemented a new no-hassle transcript review process where we will pay for the students' transcripts to be sent to the university. We'll turn those around within 48 hours so they'll know what their credits are. This Bachelor of Science degree program, when I said is designed for the adult, it is 3 semesters a year, a 10-semester total degree program. So in a little over 3.5 years, that individual who wants to start a new career will finish their degree, sort of a no-nonsense, so get it done, and be eligible then to go into the workforce. Now we've got two other degree programs that are beginning in January as well. One, we have an Associate Applied Science and Radiological Technology, which is a 2-year degree program, and that'll be campus-based. At the end of that, the graduates will be setting for their certification exam. This is another high-demand, high-need program in allied health in our area. The average starting salary for these folks, according to the Labor Bureau statistics, is $61,000 a year. The other degree program that we've got is our first master's degree program, and that's a master's degree in business administration with a concentration in healthcare management. That program will be about 1.5 years, and this is another fully online degree program designed for the working adult who wants to move up and improve their skills and their education.
Seems like people who would be going in now might be uniquely positioned when they get out. As things are getting worked out within the government right now, maybe there'll be a plan in place by the time they graduate and they'll be on the cutting edge of this kind of new era in healthcare.
I think the timing for people that want to go into these careers is very good, because in 2014 is when the Affordable Health Care Act really kicks in terms of providing that for the citizens of the United States. So the demand for people in these positions is just going to increase. And what I like about it, that these are high demand, high interest, and high wage jobs. And I want to make sure that our students, when they come in and graduate, and one of the things we will do is we will work very effectively to place them in positions. The other 2 programs that we have that I want to mention is we have a certificate in massage therapy, but the institution was founded on its doctor's degree in chiropractic, and we currently have about 800 students in that program, and we are continuing to grow that as well as the demand and the interest continues for that. So about 3 years ago, the Board of Trustees decided that they wanted to have Parker become more of a comprehensive university. And as a result of that, they said, let's add new degree programs at new levels that serve, that is within our mission as a healthcare institution. And so that's what we're doing now. And over the next 3 years, you're going to see a number of new degree programs implemented at Parker University.
I would imagine as massage and chiropractic gets kind of fully integrated into the insurance and healthcare world, which hasn't always been the case, that massage therapists and the like would be well in greater need and more highly paid now.
Yeah, it is. Right now, a lot of chiropractors have massage therapists on their staff, which makes a lot of sense. And they've integrated that within the care that they provide to their patients. And so we see that as moving forward. We see the billable part of that in terms of what insurance providers will pay has certainly now caught up with that. And so it's a natural connection between the two.
So for people who may be watching, adults may be thinking about changing jobs, and if they think of 3.5 years as maybe a little too daunting, what would you say to them? I mean, you are offering ways for it to be less intrusive
Well, when you look at a typical traditional bachelor's degree program at an institution, it is at minimally 4 years. And usually it's 2 semesters and maybe a summer school. And what can happen in those institutions is courses that you need to graduate may not be offered when you need them.
Right.
So this could be a 4.5, 5 year. And when you are an individual that has family responsibilities, looking to improve your quality of life, you want to finish that degree in a very timely manner. And that's one of the advantages that we provide students, is they can come in, they can enroll, they can start every month with new student enrollments, and they can finish their degree in a relatively short period of time. When they complete both the associate degree and the Bachelor of Science of Health Information Management, they'll be prepared to set for their certifications, which is what they will be required to work. And we also provide the placement services for those as well. But when you have a high demand in terms of career opportunity, placement is never a problem.
Yeah. Well, thank you for bringing us up to date on all that's available at Parker. We appreciate it today.
Well, I'm glad to be here, and if there are students out there that are interested, they can access the information at www.parker.edu/success, or they can call 214-902-2429, and our admissions counselors would love to talk to them.
A true spokesman. Thank you, sir. We
My
appreciate
pleasure.
it.